India's bold promise to eliminate tuberculosis, TB, by the end of 2025 is crumbling under the weight of harsh realities. With just months left, the goal seems dangerously out of reach, leaving millions vulnerable to this ancient scourge. In the shadow of Mumbai's glittering skyline lies Govandi, a suburb where socioeconomic barriers, systemic healthcare gaps, and the disease's biological tenacity have stalled progress. Take Mehboob Sheikh, diagnosed with TB 6 months ago, over a decade after his wife succumbed to it. His gaunt face and hollow eyes tell a story of relentless fatigue, job loss, and a 9-month antibiotic regimen that's left him frail. His children, malnourished and too young to grasp their father's struggle, hover nearby as he coughs. Once earning 15,000 rupees, $171 monthly, he now scrambles to pay their school fees. "If my body holds on, I'll keep living," he says. "If not, that's the end." Prime Minister Narendra Modi's 2018 pledge to eliminate TB by 2025, 5 years ahead of the WHO's global target, sent shockwaves through global health circles. Elimination means slashing new cases by 80% and deaths by 90% compared to 2015. But experts like Dr. Lancelot Pinto, a Mumbai-based respiratory specialist, call it a monumental challenge. "We're a high-burden nation," he says. "We lack the resources to scale up and meet this deadline." TB's persistence in India is fueled by a toxic mix: biology, poverty, and healthcare gaps. Mycobacterium tuberculosis, the culprit, has haunted humanity for millennia, lurking dormant in bodies and developing drug resistance. It thrives in India's densely populated, impoverished areas, where access to consistent care is a luxury. Health worker Pramila Pramod, who spent a decade in Govandi, sees the same number of TB patients monthly. The suburb's alleys airless with open drains and overcrowded rooms or perfect transmission pathways. Stigma compounds the issue. Patients often hide diagnoses, fearing rejection. A young girl of marriage age, her parents won't tell anyone she has TB, Pramod shares. How will they find her a husband otherwise? And this is the part most people miss. India's healthcare system is ill-equipped to combat this crisis. Decades of underinvestment, staff shortages, and outdated facilities plague the public sector. The private sector, though vital, is costly. Diagnostic strategies rely heavily on 140-year-old sputum microscopy, missing active cases. Modern molecular tests, which detect the bacteria's DNA, are used in just over 1 in 4 diagnoses. This gap leaves countless infections untreated, allowing drug-resistant strains to spread undetected. Unless we detect and treat proactively, we'll keep missing cases, Pinto warns. Take 15-year-old Sufia Syed, who battled chest aches, fevers, and debilitating headaches for over a year before her TB diagnosis. Her weight plummeted from 88 to 55 pounds, yet she still attended school. Now nausea and sleeplessness leave her too weak to focus. "Every morning I feel like I'm blacking out," she says. "Sometimes I go days without food." The government has ramped up efforts, offering free testing and medicines through public facilities. Progress is visible. Cases have dropped by 17.7% since 2015, nearly double the global average. But with months to go, challenges persist. Staff shortages, poor mapping of high-risk areas, and inadequate health-seeking behavior. The COVID-19 pandemic exacerbated these issues, halting screenings and diverting resources. Innovations like AI-powered X-rays offer hope. Tools like Cure AI software rapidly scan lung images, flagging potential TB cases crucial in areas lacking radiologists. These portable devices, weighing under 3.5 kilos, can screen entire communities in a day. The Indian government has embraced this approach, performing nearly 5 million X-rays. But for patients like Sheikh, who hasn't received promised cash assistance, these advancements feel distant. No one has come to help us, he laments. Here's the burning question. Can India's ambitious target ever be met? Or is it a well-intentioned but unattainable dream? Experts argue that while deadlines matter, aligning efforts and celebrating small victories are equally vital. But for millions like Sheikh and Sufia, the clock is ticking and time is running out. What do you think? Is India's TB elimination goal realistic, or does it need a rethink? Share your thoughts below.